Greetings from Hershey, Pennsylvania. I'm Dhawan, one of your associate editors for the Arthroscopy Journal. I'm pleased to introduce the September 2015 issue of Arthroscopy. In this issue, we have 18 original articles and 6 systematic reviews and meta-analyses, in addition to several editorial commentaries. In this issue, we continue down the path of the Copernicus Initiative with the second and third of the 4-article series. For those of you that are unfamiliar with this, the Copernicus Initiative is an effort by the Arthroscopy Association of North America to study the paradigm shift from an apprenticeship model of arthroscopy skills development to a proficiency-based progression model. This was a direct result of tireless research, examination, and observation of other businesses, industries, and professions like NASA that also train highly technically skilled individuals. The first of the 4 study series was published in the August issue. The second and third studies, published in this month's Arthroscopy Journal, evaluate the training tools. Specifically, a dry shoulder model simulator and a cadaver shoulder using the previously validated performance metrics for an arthroscopic Bankart repair. Using the assessment tool, the performance of an experienced group could be distinguished from a novice group on both the dry shoulder model as well as the cadaveric shoulder. This evaluation of proficiency-based progression learning, using Bankart repair as a template, will soon be expanded to include studies on ACL reconstruction, rotator cuff repair, and hip labral repair. I hope you will take the opportunity to read these studies as we are witness and contributor to this evolution in surgical skills education. We have 3 fantastic studies on hip arthroscopy in this month's issue. I'd like to highlight one of them by Dr. Dhawan and colleagues evaluating acetabular base repair versus circumferential suture repair in a matched paired comparison. This was a review of prospectively collected but retrospectively reviewed data on 220 patients, 110 in each treatment arm. This study demonstrated patient-reported outcomes as well as revision, including conversion to arthroplasty, at 2 years was no different regardless of type of labral repair. Moving to the knee, I wanted to highlight several outstanding studies. The first, a prospective randomized controlled trial by Dr. Lubowitz and colleagues, evaluated suspensory versus aperture/interference fixation of soft tissue allografts used in ACL reconstruction. 64 patients were randomized to one treatment arm versus the other, and the authors' results demonstrate using their surgical technique, including an all-inside ACL reconstruction using soft tissue allograft, the use of suspensory fixation versus aperture fixation on both the tibia and femur, resulted in no significant differences in AP stability or patient-reported outcomes. A systematic review and meta-analysis by Dr. Chua and colleagues looked at outcomes of single-bundle ACL reconstruction using hamstrings autograft, using either an anterior medial portal femoral drilling technique versus a transtibial technique. The authors demonstrate that though the surgeon-recorded objective stability was improved with Lockman and pivot shift tests, there was no difference in patient-reported outcome scores, specifically Lysholm scores. These previously highlighted studies continue to demonstrate the complexities of factors that translate into clinical outcomes beyond just the biomechanical and kinematic time-zero influences. Last but not least, I would like to highlight the systematic review on complications of tibial tubercle osteotomy by Payne and colleagues. These authors found the tibial tubercle osteotomy to have a relatively low overall complication rate of 4.6%. These authors found, perhaps not surprisingly, that the overall risk of complications increased by over 200% when the tibial tubercle osteotomy was completely detached instead of maintaining a distal periosteal hinge. I hope you'll take the time to read through the many excellent articles in the September 2015 issue. As always, it has a wide variety of outstanding peer-reviewed literature that may help you with your own practice. Also, if you have a chance, please check out our sister journal, Arthroscopy Techniques, where you will find multiple useful peer-reviewed video articles providing tips, pearls, and pitfalls to many innovative as well as everyday procedures and techniques that are utilized. Thank you.